Marcy Crouch is known as the Down There Doc on social media. She's a mama, she's a doctor, she's dedicated to serving, empowering, and equipping women and the birthing community from birth prep through postpartum recovery. Providing elevated care and setting a new standard for women, Marcy arms her clients with confidence, valuable tips, and information that will maintain their physical health and wellness for a lifetime.
You're listening to the Imperfect PCOS podcast, where we share no BS science-backed strategies to put your PCOS into remission. I'm your host, Corey Ruth, aka the Women's Dietitian. Let's get into it.
Welcome, Marcy. I am so happy to have you on my podcast because I was a guest on yours, and we've done a couple of other collabs since then. So I immediately thought of you when I was thinking of how I can provide the women who are listening to my podcast with some excellent pelvic floor therapy tools and tricks and info, because it's definitely needed, and it's not something that we get really, I would say, any education at all on.
Yeah. Thank you so much. I'm so excited to chat with you. I always love our conversation. So thank you so much for thinking about me and all that great stuff. So I'm happy to talk shop. You know me, I will talk about vaginas until the cows come home.
Yes. I love that. And I love that about you. Well, let's begin with always, kind of the first question, which is, I want listeners to know a little bit more about you, your personal journey, how you got into pelvic floor therapy. It is such a, well, I mean, maybe we don't feel like this when we're like fully immersed in these areas, but I feel like it's such a niche, at least to me. So tell us that story.
I love telling the story because it's like every time I tell it, it brings me back to like the start of my, and it's just like,
so great.
So I will say you're totally right. This is a niche or niche, or, kind of however you say it, for physical therapy. A lot of times people don't really understand that there's physical therapists who specialize in this type of work, and we'll kind of, explain what that means later. And, I've been doing this for a long time now, and there are more of us coming kind of into the space. But it's still not talked about for lots of reasons. It's not very common. So it is. Even now, I get people who are like, oh my gosh, I didn't even know that this was a thing. And what is this? And what do you mean? So it's always, I love like the education piece of this, because I think a lot of times, like once people hear kind of what we do as pelvic floor PTs, they're like, oh yeah, I have something like that, or my friend has that, or I heard about that, and it kind of just like brings women and moms together a bit, because we start to realize that we're not so isolated, and we're not, going through a lot of the stuff on our own. So so it's funny because I started doing this work kind of right out of the gate. So I was in graduate school for physical therapy, getting my doctorate in LA, and I had just gotten married. So I was like a newlywed. I was younger. None of my friends had gotten married yet. Nobody that I knew was having kids. It wasn't even on the radar, and I was like, I'm never going to get married, and I'm never having kids. I was like, totally
jokes on us. Look at us now.
Yes, I know. Like first one that got married. So I was in grad school, and I had thought that I was going to go into kind of what, is typical for physical therapy. So sports, orthopedics, whatever. And it's our first semester, first anatomy class. And I remember it, like it was yesterday. I remember what I was wearing. I remember where I was sitting. I remember the professor, and we still talk about it. This professor and I, like, 16 years later, I'm like, it was you.
Oh, that's so cool.
She's like, I know. So she's teaching the section on, spinal musculature, and she goes into the pelvis and pelvic floor. And shows a picture of the pelvic floor muscles, which is like, shows a picture of kind of the vaginal opening and, the anal opening, and, and I'm looking at it, and I'm just like, wow, that's a lot of muscles. And then she uses the example of a woman who had a significant vaginal tear during childbirth, and then had a lot of problems afterwards in her life in terms of pain and incontinence and all these things.
Got it.
And Corey, I remember I was like staring at that picture and my mouth just open. Like I just
Yeah.
dropped.
You're like,
And I
now
was
I'm
like,
never having kids.
yeah. Well, I was like, what?
Yeah.
You tear?
Oh,
Like,
yes.
I was like, what do you tear? Like I had no, it was like something was
Oh,
completely, it
yes.
like blew my mind. It was like one of those
Wow.
life-changing moments. And I was like, what
Yes.
in the good Lord? Like how, and so
Yes.
I just, that made like a really big impact on me. And
Yeah.
I became super interested in it and decided that that was, something that I'd like to pursue after
Hmm.
doing some education and research, like knowing there's not a lot of PTs out there, but it's
Yes.
this huge population of women and moms
Right.
who are, having these common but not normal
Right.
problems that
Mm.
are lasting years and years and years and really influencing their everyday function and quality of life.
Mm.
And I was like, how can we be like these highly educated PTs, right? That are like movement experts, injury
Yes.
prevention, rehab people, like, getting high level athletes back on the court, like all of these things. Like, how are
Yeah.
we doing this? But we're not even like talking about this injury that happens with moms. And I was just like, as a
Yes.
medical professional and as like a rehab person, I was like, that
Hmm.
makes zero sense. Like, I don't understand
Agreed.
that. So I
Agreed.
just like, that's really all I've ever done. I mean,
Uh-huh.
I tried to get as many clinical rotations as I could in women's health and pregnancy, postpartum stuff and
Right.
pelvic floor issues. And
Awesome.
I went right into residency after I graduated. And then I've been fortunate enough to work in clinics in locations that were, pretty much solely pelvic floor and women's health. So I
Hmm.
will say like it is my specialty. I'm not great with like elbows,
Hmm.
or
Me
ankles,
neither.
but yeah, but I'm like, tell me everything about your vagina,
Yeah.
your birth. I want to know everything about that. But I mean,
Yes.
I started in it, before I had kids, and
Okay.
it's been, yeah, it's been great, but surprising to me when I started, I guess I should say.
Right. Oh my gosh, amazing. You've come full circle. So
Yeah.
is pelvic floor therapy, and this is just a general question, is
Yeah.
it mostly for women who've had children or okay.
Yeah. That's a
So
great question. It's a great question. No,
okay.
no.
Okay.
I mean, I think we associate it the most
Yeah.
with women who have had children,
Okay.
because we see kind of the most prevalence in like,
Got it.
vaginal tearing or C-section or pain with sex or
Mm,
leaking urine, prolapse, like all these
okay.
things, right?
Got it.
But men have pelvic floors, and we
Mm,
see, like a lot of men who have persistent pelvic pain and bladder issues.
mm-hmm.
I
Right.
saw a lot of men when I worked in California who,
Mm-hmm.
were had a lot of sexual dysfunction and pelvic pain.
Mm-hmm.
Um,
Mm-hmm.
and what we're seeing now too in our younger women population, especially our female athletes, we're seeing some incontinence and pelvic floor dysfunction with some of our like jumping sports. So
Interesting. Oh, no.
yeah,
Okay.
like gymnastics,
Mm-hmm.
volleyball,
Right.
any sort of like kind of high dynamic where it's like a lot of load on the pelvic floor muscles.
Got it. That makes
And
sense
I've
though.
seen there's a pediatric
Oh, wow.
subspecialty of pelvic floor stuff. So there's
Mm,
pediatric PTs who do pelvic floor issues for kiddos that are having like chronic UTIs,
mm-hmm.
nighttime wetting, chronic
Got it.
constipation, that sort of thing.
Mm-hmm.
And then I've seen a lot of younger women who haven't had babies yet, but have maybe frequent UTIs, yeast infections. They have kind of this cycle of inflammation and infection, and they start to get
Mm-hmm.
pelvic floor issues. And then like they, sex becomes painful or they can't
Mm,
put a tampon in, or I've had
got
women
it.
who could never, like, weren't able to consummate their marriages. Like there's all sorts of different kind of layers
Mm-hmm.
here. So it really is for anyone and everyone. I tend to specialize more in the pregnancy and postpartum because that's kind of where my passion really lies, and
Got
like where
it.
I'm kind of like niching down a little bit
Mm-hmm.
more.
Right.
But yes, from like a clinical kind of practice standpoint,
Mm-hmm.
we can see anybody at
Okay.
any age.
Okay,
really.
good to know.
Mm-hmm.
Yeah, and I didn't even think about the men having those issues. When
Absolutely.
I was growing up, we got a trampoline in our backyard. And I
Yeah.
remember saying, Mom, and I think I talked to you about this on your podcast. I said, Mom, come jump with me. Come jump on the trampoline with
Mm-hmm.
me. And my
Yep.
mom would say, and let me tell you too, my mom is maybe like 100 pounds, and
She's
I was
tiny.
an almost 10-pound baby, and she had
Yes.
two unmedicated vaginal births.
Oh
Okay,
my
so
God.
that's just to set
Yeah.
the scene. And so, Mom, come jump with me, and she'd be like, "Oh no, honey." And one day I really was like, "Mom, why can't you jump with me? Like, what? I
Yeah.
really want to play with you." And she goes, "Well, honey, like I might pee my pants a little bit if I jump on the trampoline." And it made no
You're
sense.
like,
I could
why?
never connect it. I was like, "Aren't you potty trained? What's going
You're
on?
right.
What's happening?" And I
Yeah.
never really thought about it again. And I was always jumping the trampoline. After I had my daughter, I was with my fiance's family, and they had a trampoline. And
Mm,
his little cousins were, or his little nieces and nephews were like, "Come jump with me." And I'm like, "Oh, cool." So I jumped on. Guess what? Immediately, I just
immediately.
felt a drop in my underwear. And I was like, oh, I know what my mom was talking about all that
Yeah.
time.
Yeah.
So
Yeah.
very interesting there.
Yes.
Yeah,
Yes.
it's fascinating, how much changes, everything changes, I feel like,
Yeah.
after we have babies. So tell me how you can work with clients, like walk us through how
Mhm.
pelvic floor therapy might benefit somebody. What are
Mhm.
like the maybe
Mhm.
a few of the top most common issues that you
Yeah.
see, and how you help women to make improvements there.
Yeah, yeah, yeah. So I think the trampoline story is like so relatable
Yeah.
because I feel like
Still won't jump on one. We
everybody,
have one
yeah,
here.
everybody is
Mhm.
like like trampoline, bounce houses, those
Yeah.
like stupid, indoor bouncy,
Yeah.
like ball pits of death places
Yeah.
that we take our kids, all of that stuff. It's like it affects it's like as soon as you say like, oh, I'm not going on the trampoline, like you
Yeah.
just look at the next mom next to you
Yeah.
and you're just like, I know,
I
right?
get
And it's like
it.
you don't even have to say
Hmm.
anything or know her, right?
Yes. Yes. Now I get it.
So
Hmm.
yeah, so that kind of brings it to like the most common kind of issues that we see in pelvic floor PT. So
Okay.
in my world as like pregnancy and postpartum, I
Hmm.
would say kind of the most common would be leaking urine. So that's,
Okay.
leaking pee with either the
Yes.
urge to urinate. Like some people get, that urge like, okay, I have to go pee, and then they're like,
Yeah.
oh crap, I can't hold it, and then like
Okay.
you leak everywhere with that urge, or like on your way to the bathroom.
Got
Okay.
it. Okay.
The second type of incontinence is called stress incontinence. So this
Okay.
is where what you're describing with like the jumping. So
Okay.
this is where you leak urine with,
Physical.
yeah, like laugh, cough, sneeze,
Okay. Yeah. Got it.
throwing up,
I did that while I was pregnant.
running, yeah,
Not
jumping
that part.
jacks,
Yeah.
exercise. Yes, things where
Yes.
like you are
Got it.
doing like,
Screaming.
yes, like increased downward pressure on the
Okay.
pelvic floor. Okay.
Got
It's
it.
like stressful. So
Not
that's
because my vagina is stressed out.
totally. I
Okay.
mean,
I
sometimes.
mean, yeah, I guess it is. It would be, right?
Sometimes. Yeah.
Yeah.
Yeah. I mean, my vagina gets stressed out a lot.
Oh my God.
So I feel
Yeah,
like
she is very sensitive, that one. Hmm.
yes, she is. Yes, she's one of our, yes, she is. She's very high maintenance. Um, and
Bougie.
then yeah, so that would be one that's very, very common. And then the second thing would be prolapse. So
Okay.
this is where we have our pelvic organs. So our
Yeah.
bladder, urethra, cervix, rectum,
Hmm.
uterus kind of sit a little bit lower in the vaginal canal
Okay.
after being pregnant or having babies.
Okay.
And this is also kind of due from like weakness in the pelvic floor and some lack of
Mm.
support. So oftentimes prolapse and leaking kind of go hand in hand.
Can I ask a
Uh,
question there with
yeah,
prolapse?
yeah.
I have a friend who we're not close, but she quit, like a friend of a friend, basically. And she has two babies under two. She
Mm-hmm.
had prolapse after her second. Is it more
Mm-hmm.
common to experience that, or any of these issues if you have babies closer together? I've always thought about that when I think about prolapse and like my friend. Like,
Yeah, yeah, it's a really great question. And the literature is kind of mixed on that.
okay. Interesting.
I would say like anecdotally what I see, and like just from a mechanical standpoint, like yes, that would make sense.
It makes
to me,
sense in
right?
my head.
Totally,
Yeah.
because
Okay.
there's not a lot of like recovery time, right? And sometimes like
Right.
people will have, and this is interesting too that we can kind of talk about, but like C-sections, even if you have like a planned C-section and
Oh,
you're not
yeah, right.
doing any pushing or vaginal,
Uh-huh.
birth, you can still have these issues because it's not necessarily like the birth that does it. It can be like the strain of the pregnancy, because
Oh,
that's like,
interesting. Yeah.
yeah,
Okay.
it's like
So,
9 months of
yeah.
increased weight that's just getting heavier and
Yes.
heavier and heavier on like a group of tiny muscles, right?
Right.
So I think, if there's not a lot of time in between pregnancies and we
Mm.
haven't kind of like regained that, strength and
Strength.
rehab portion back, like I would say,
Got
yeah,
it.
you probably are at an increased risk to having something like that.
Interesting.
Um,
Okay. Good to know.
yeah.
Okay.
And some of the other risk factors would be, well, I should say some studies say that it's like the first baby that does it. Like
Mm.
some studies are like,
Mm.
doesn't matter. First baby that comes out the chute
Everything's
does it. And
really,
then everything else kind of just
yeah.
like either stays the same or, maybe gets worse.
Okay.
Other studies say, nope, it's like the compounding,
Ah,
multi-parity, right? It's
okay.
like the more babies you have, the more prolapse you could potentially have. Now,
Okay. Hmm.
I've seen it both ways in the clinic,
Okay.
you know,
Good to know.
and I mean, I had a mom who had 6 children,
Oh gosh. Super
and
mom.
yeah, super mom,
Super
six,
mom.
6 kids. And she had like not that bad of a prolapse. I mean, it was there, but it was like the same amount as somebody that had two
Oh.
babies,
Okay.
and then I've seen
Hmm.
people that have like one baby have like a very significant prolapse.
Hmm.
So there's lots of risk factors and lots of
Mhm.
different, things that contribute to prolapse, like
Okay.
genetics, size of the
Yeah.
baby,
Right.
position, instruments, like all these things.
Yeah.
But this is like a tangent,
Yeah.
but
No, it's
yeah, I mean
cool. Because
there's definitely like different types kind of, risk factor wise.
okay.
So yeah, so prolapse would be one, and prolapse
Okay.
isn't painful. It's more like you could see it, if you're
Mm,
in the shower after you had a
mm.
baby and like, you're wiping, or the first time you look in a mirror and you're like, oh my God,
Did
like, what
not
am I
do
looking?
that. I did not do that.
Yeah.
I wish I would
Don't,
now because I'm curious, but I did not.
yeah.
I was too scared.
Yeah. Yeah. I mean, it can be for sure. You might like notice like a little pink, kind of ball of tissue that you didn't
Mm.
notice before. And
Okay.
it can contribute to feelings of like heaviness or
Mm.
bulkiness, like something is kind of like
Got
falling
it.
out of the vagina. Yeah.
Okay. Yeah, that's how I.
But it doesn't hurt.
Okay.
It's not hurt for, okay. So
Got it.
prolapse, leaking. And then the third most common would be painful sex after having a
Okay.
baby, whether you have C-section or vaginal delivery,
Okay.
because of all those reasons that I said, just
Okay.
sometimes the load of the pregnancy will cause
Yeah.
muscles to get tight. And if
Okay.
you had a vaginal delivery and had any sort of tearing or trauma, scar tissue can form, which can be very painful. Muscles can
Hmm.
get super tight, which can be painful,
Hmm.
and difficult to, put something into the vaginal canal. So those kind of are the three. There's lots of other ones, core weakness and back pain and
Mm.
tailbone pain and anal fecal incontinence. Like there's all sorts of things, but I would say
Wow.
kind of those are the three big ones. And then we have some subsets under each of those.
Okay. So would you say then that if someone is listening here and they
Mm-hmm.
are experiencing either urinary leakage for any of those reasons
Mm-hmm.
we talked about, either just, kind of not being able to hold it or some
Yep.
physical pressure or whatever,
Yeah.
or any kind of prolapse issues or any kind of pain during sex, then they are somebody who is a perfect candidate for pelvic floor
Yeah.
therapy and they should be seeking out help because these things are not normal.
Normal. Totally.
Okay.
And I would even say too, Corey, that
Yeah.
what I'm seeing, and part of the reason why I went kind of online, right, and like
Mhm.
transferred over to the online space is
Yeah.
like kind of this shift into some preventative stuff as
Okay,
well.
cool.
And so I'm trying to reach women
Mm,
who might be
awesome.
pregnant for the first time
Yeah.
and don't have any issues yet, right?
Mm-hmm.
Like they haven't had the baby yet. They're doing okay,
Yes.
but we're trying to prepare them for the delivery to reduce the risk of
Got
pelvic
it.
floor issues down the road.
Cool.
Which is like super exciting and really
Yeah.
fun,
Oh, I love that.
because we're starting to really educate women and new moms on what birth actually is.
Yeah.
Right. And
Right.
like, yeah. And
Oh,
what to like really expect and
yes.
how to go into this process being, armed with information and empowered. And even if there's like something scary happens or something kind of
Mm-hmm.
happens that we didn't quite plan for or can't plan for,
Mm-hmm.
you can have you can still have a great experience and have better outcomes
Mm-hmm.
because you knew that was a possibility, right? Like a lot of
Right.
times what happens, and I'm sure you could probably relate to this being a
Yeah.
mom,
Mm-hmm.
is that it's like we don't know anything.
Right.
And then, something happens, we have a big
Yeah.
tear or episiotomy, or we have to go to C-section, or the baby,
Right.
something happens and we're like, oh my God, we didn't even know
Yes.
that was like on the table. And
Right.
so then there's all these feelings of like, well, I should have done this, or I should have asked this. And why don't tell me about this? And I didn't know about my pelvic floor. And I didn't know that there were like, the nurse told me I had to give birth in this position. And there's all these like things that could be changed,
Right.
so,
I love
yeah.
that.
So
Oh,
definitely if there are
so
symptoms
great.
present, 100%,
Yes.
appropriate, but
Right.
also I think, and well, actually, I should say, I know
Mm-hmm.
that everybody should come in for pelvic floor assessment,
Yes.
regardless of symptoms
Oh,
or not,
I so agree. I
Yeah.
so agree. And
Yeah.
yeah, sorry, keep going.
No, I was going to say, just because I think that we could catch a lot of things
Oh, yeah,
and
totally.
we could do a better job of preparing. And then even like in between births, too, like just like you would go in and see your OB or your midwife or whatever, I think people need to come in and see pelvic floor PT, get a baseline, teach you
Yes.
some things about birth and delivery, what you can do exercise wise, stretching wise,
Yes.
pelvic floor wise, bladder health wise. Then at that 6-week mark, you come back when you see your OB, get into therapy,
Mhm.
start rehab. There's just so many places that we can insert this type of care that's not there now.
Right.
And it would really solve a lot of problems.
So
And
agree.
it's a little crazy to me that it's not
Same.
standard.
I
Mm.
know other countries, I think from people that I've just talked to, like on Instagram and,
Mhm.
followers and stuff, whenever I post about it, they're like, oh, well, here in Denmark or, wherever they are,
Mm.
we
France.
get,
Yeah.
it's an included thing. Like that's an automatic. I'm like, what is wrong with us?
Yeah.
Crazy
Yeah.
sorry, what?
No, I was going to say France does it
Yeah.
automatically.
Yeah.
Yeah.
Why can't we be like France?
I, I don't know.
Oh, I actually asked my doctor this time after I had my son, my second and last baby. I asked him if I could get a referral. And I live in a rural area, so I was fully expecting him to say, we don't have anyone in the area.
Mm.
And I was like, okay, well, at least I asked. And what I was told instead, and this is no shade to docs, but I think we don't have enough education around this topic.
Yeah.
And our doctor's
Uh-oh.
not educated enough about this topic. I was told, oh, that's if you tear, what did he say? That's if you tear north, south, east to west, or something like that.
Oh,
If you
God.
if you tear like level 10 all the way, what he said something like he's a funny guy. He said something like that's if you're like you tear and you're like blown open or something like that.
Oh,
And I was
God.
like, oh my gosh, I don't think that's correct.
No.
Because I really wanted to work from that preventative side. And at the
Mhm.
time, I really felt like I needed it. And luckily some of those things resolved and it was kind of just a postpartum very quick thing.
Yeah.
Oh my gosh, I was like, wow, if that's what we're being told, you can
Yeah.
see, and he knows I work in healthcare, right? So if I'm
Mm.
being told that, then imagine,
Yeah.
what others believe about this really important area that they can get better care in.
Yeah.
So.
And it's so funny because you're in Canada, right? Are you in
No,
Canada?
California.
Oh, you're in California. Okay.
Yeah.
Why did I think Canada for
I
some
don't know.
reason?
I'm
Um,
right on the California-Oregon border.
okay, okay.
Yeah.
Okay. So it's so funny because like I have heard so many things,
Yeah.
it's like, I've heard
Yeah.
so many
Oh, me
responses,
too.
and,
Yeah.
and I've been doing this for a long time.
Yeah.
And you would assume that
Mm.
as somebody like, goes through the career for a long time, kind of these responses change, right? As we would get more evidence and as we would,
Hey, that
this
makes
becomes
sense
a
to
little bit
me.
more, yeah, it
Yeah.
doesn't. It
Ah,
doesn't. I mean,
really?
it's like that response is something that, I've had patients in Los Angeles tell me that they've heard. So it doesn't even matter whether you're in like a rural area or a booming metropolis.
Mm,
That's a common
that's
response.
discouraging.
Either like, you don't need it,
Yeah.
it's normal. That's only for people who like, are,
Blown
you know,
open.
yeah, like,
Well, it kind of was. I mean, right? Like,
yeah,
this
right.
one came out Fast and Furious, so I kind of was.
Yeah, exactly. Or it's like, wait until you're done having kids. What's the point of doing it
Uh,
now? Or
uh,
just wear a pad and then when you're older, we'll have surgery. I mean, there's
ooh,
no like, yeah. And
mm,
it's so frustrating because that doesn't happen in any other aspect of musculoskeletal injury. And that really is what this boils down to. Like,
mm,
this is a muscle injury, whether it's torn or cut
right.
or overused or whatever. It's a muscle problem, muscle nerve joint issue,
Yes.
right?
Yeah.
So, like,
Right.
just take out the word pelvic floor and insert, shoulder
Right.
or rotator cuff. And
Yes.
the response to that would not be
Put on,
wait until you're,
put on a shoulder
60 and
pad.
then have shoulder. Yeah. Like,
Yeah.
oh, that's only for people whose arm gets amputated. It's like, it's not
Oh,
the same, but it's the same, injury. So that
yes.
that really is also part of the driving force behind
Yes.
kind of coming out of the clinic and
Mm,
working more
yeah.
in the virtual space, because
Yeah.
there are a lot of limitations about accessing this care, that being one of them,
Yeah.
like the response from doctors, to
Yes.
like geographic, there's just not a lot of
Right.
us out there. I mean,
Right.
I had patients when I worked in Los Angeles that would fly in to see me. I had patients when I worked
Wow.
in San Francisco that would fly in for a week. Like, people
Amazing.
would do it,
Yeah.
because like they don't have that type of care. So you're
Right.
limited by geography, you're
Yeah.
limited by time,
Mm,
being a mom,
mm.
it's
Yeah.
hard,
Right.
like I have two
Totally.
small kids, I
Yeah.
like when they're sick, I got to close a clinic, and
I
like
know.
that's not fair
Mm-hmm.
for anybody. I mean, it's all,
Mm-hmm.
and I had a lot of patients that would come in,
Mm-hmm.
postpartum, and then as soon as I go back to work, maternity leave is over, you
Mm.
can't keep up with your own appointments because
I
you've
know.
already used all your paid time off. You have to get
Yeah.
the kids to school. You're paying childcare. You
Yeah.
can't leave
So
work in the middle of
true.
the day. Like, there's all these barriers.
Yes.
So
So true.
like the virtual, so I'm like, okay, how can we give the best part of what we're doing in the clinic, transform it into a way that you can um,
Mm.
get the same benefit, but do it, like virtually. So
I love that.
anybody could do it without the limitations of schedule, geography,
Mm.
insurance,
Parking.
referrals,
Yeah.
time. Yeah,
Yeah.
all that stuff,
Yeah.
because
That's
those
amazing.
barriers are for everyone. Everyone is
Yes.
experiencing them.
Yeah.
And
So true.
that shouldn't be the reason why you can't get pelvic floor care because you're leaking you know what I mean? Like,
Right.
it doesn't make sense to me. And I'm sure, and a lot of women too, when they get responses like that, they think, oh, okay, well, maybe I am crazy, or, oh,
Mm-hmm.
it is normal. Okay.
Yes.
So I guess this isn't a big deal, or, all
Yeah.
right, well, maybe I'm just being too sensitive. It's like this
Yeah.
kind of reinforcing
Mm.
behavior that,
Yeah.
women's health doesn't matter, and that
Right.
you just have to deal with it now because you're a
Yes.
mom and that's what you wanted. So, shut the hell up about it and
Yeah.
go wear a pad,
Yeah,
right?
I doubt men if they, it's so true. I doubt men if they go in there for, they're leaking urine out of their dicks. I doubt they're given a diaper and told to have a nice day. And the very staunch feminist in me just gets really worked up about this, so we won't go
Yeah.
on further. But
Yeah.
yeah,
No, I know.
I'm
I
so
mean,
grateful that you're in the space, just doing the Lord's work.
doing the good work, doing the good. But I mean, it's very true. And there was this very poignant TikTok. I'll try to find it. It was so sweet. It was like maybe a year ago. This mom posted this picture. She was like, a couple hours postpartum, or it was a TikTok video. A couple hours postpartum. She's in her diaper.
Intense.
Yeah, super intense. Like, she's crying, as we've all been there. She's got her brand new baby, and she's talking about how, she had all this care and all this support during pregnancy, all of these appointments, all of this attention.
Yeah.
Minute baby comes out, it's like all about the baby. She's like, mom gets pushed aside, and she's like, she was concerned about her pain and about her leaking. And like, and she was crying, and she was like, yeah, I'll just, sit here in my diaper and shut up about it because, now the baby's here. And it's like, so true,
so
and
sad.
yes. And it's just heartbreaking. And it's 2023.
I know. Right.
Like, why is this still such a taboo issue? Like, why is that still, I don't understand that,
It's so true. I know. It's so true. Yeah. Oh yeah. And I remember getting when I had my baby, my first one, because my second one I expected it, but my first one, I was given Tylenol after. That's it. And you think about what men get after a vasectomy, they get like narcotics. And it's like a 20-minute procedure, and it's like a day recovery. And I got some Tylenol, and it was probably like $100 a pill, but we won't get into that. So yeah, we could go on and on, but
they get like a snack. They're like, here, eat this. Yeah, they get like a sandwich. They're like, here, eat this sandwich before we have this procedure. And here's an ice pack, and you get to lay in this bed. And I'm like, you know what? Give me the scissors.
Yeah.
Like, I'll happily do that shit. They don't need a sandwich. I had to get my IUD.
Saltines.
Oh, I know.
And a pack of peanut butter, Jif peanut butter, and a Tylenol. That's what I got.
Rude.
Yeah. Yeah.
So rude. I mean, I had to get my IUD put back in because, it just fell out the other day. And yes, it did. And I went to go get it put back in, and like nothing, no general, no numbing cream, no nothing. And I'm just like, wow.
Oh God, I've heard really horrible stories about that.
It's not great.
Yeah. Yeah.
It's not great. I mean,
we'd rather be doing something else.
Yeah. I mean, I'd like a little, sandwich or.
Right. I'd like a sandwich with or without my IUD.
And like a little pain med for that. You could give me like a Valium at least.
Yeah. Right.
Like
check out for the day.
Give me a diazepam.
Yeah.
Like, come on.
Oh, right. Oh, I know.
There's no way around it. PCOS is complex and multifaceted. What we know about it, including how best to treat it, is constantly changing. That's why I've dedicated my life's work to helping women put their PCOS into remission. Inside my signature program, the PCOS Boss Academy, women lose weight permanently without restriction and master their most stubborn PCOS symptoms. If you're looking to get pregnant or want to be a mom in the future, my ultra-successful Get Pregnant with PCOS program supports moms-to-be every step of the way in conquering PCOS symptoms and bringing home the baby of their dreams. Plus, there's an additional weight loss mode to check into. These are all of the science-backed nutrition and lifestyle tweaks you need to improve your PCOS and change your life from a qualified healthcare provider and leading PCOS expert in the field. Ultimately, we are in control of our PCOS, and I would love to work with you inside one of my upcoming programs so you can step into the best version of yourself and start feeling like you again.
So along the lines of birth and postpartum, what are a couple tips? And, I'm sure you get asked a lot about if there's a way to prevent tearing and like if there's some tips for like making the labor process potentially easier. What are like top 2 tips for like tearing in labor, and then maybe like top 2 tips for postpartum. Like, and these can be, general, we're speaking to women who are pregnant, or, maybe will be in the future. What would you say this would be? And sorry if you can hear my dog barking. She's the
oh no.
and the mailman comes every day, but every day it's a shock. It's still a shock every day.
She's like, that guy is here again.
Yeah, he's here to rob us. I'm like, nope, he's just we have envelopes. Okay, so a couple tips there.
Yeah, it's great question. So I actually have a system for birth prep. I call it the 3 Ps.
Ooh.
And this is what I teach in my webinars and my online courses. So the first P stands for perineal massage. So this is a way to reduce the risk of significant tearing and trauma by starting to kind of prep the tissue in the pelvic floor by specific stretches and positions and exercises for that. And I teach kind of more specifically how to do that. So perineal massage is the first P. Second is I call push practice. So this is where I teach women how to actually push. Like how to get their pelvic floor to bear down and lengthen. A lot of times people think that pelvic floor muscles push a baby out. So like we need to do Kegels for birth, but it's the opposite.
Got it.
Pelvic floor muscles basically have to like go away. They have to get out of the way. And so we have to learn how to help them do that. So I teach that, how to do that. And then I teach them how to do that in different positions that you might choose to birth in. So whether, you get a better push in side lying versus squatting or, semi-reclined or in the tub or whatever the case may be. We kind of practice all of these different positions. So you and your partner, if you have one, get a feel of like what it may be like. So like the first time you're not trying to get on your side and push a baby out is like when the baby is crowning. It's like, okay, I've done this, I know this. And the partner or whoever your support person has been like, okay, I know I can hold the leg here, or I know that she likes this. So like you practiced it, right? It's just like a baseball pitcher.
Right.
Like we teach baseball pitchers how to pitch.
Yes.
Right. They don't just like go out onto like a major league game with never touching a baseball before, So it's the same kind of idea, right? It's like, let's train for this. And then the third P is practice like you play. So this is where we put all 3 things together. So for example, I would have somebody doing the perineal massage techniques that I teach in a birthing position that they like with some of the pushing. So we're starting to really kind of put ourselves in these functional positions and get used to, okay, so like if this is starting to burn or stretch a little bit, like I've been here before, and then we can start to go there. So so we teach that in our courses and our online programs. The other tip I would say for birth, and I think this is really important, is to have kind of these. So like I put a manual together in our courses that have like pre-scripted questions for your providers that you can take in to your appointments.
That's
like
so helpful.
Yeah, like per trimester. So, and it's not just like how big should the baby? Yeah, like it's not like how big should the baby be or how much weight should I gain? It's like, what is your rate of episiotomy? How do we make the decision about going to instruments? Like how would we decide to go to C-section? Who, would repair a grade 3 tear? Like, like all of these like pelvic floor specific questions. So you can start to think about, what could happen and what the answers would be. So you're not like blindsided. So I think having that ahead of time can really take a lot of the anxiety of the unknown away, which will put you in a better headspace for delivery, right?
Which you need that. Yeah.
100%.
It's very mental.
Yeah, for sure. For sure.
So cool.
So I have that because a lot of times people don't even know like what they should be asking.
Oh, I know. Oh, 100%. Where do we ever learn that unless like our friends tell us or something? Yeah. And our like our moms forget, like it's been a while, so
And then if your friend says like, oh, I had an episiotomy, you're like, oh, well, it's not going to happen to me. Like, right.
Right.
And so then you don't think about it, but it's
Yes.
like after the fact, if you had something like that happen, then you'll be like, man, they didn't even tell me that they were going to cut.
Yeah.
Or
Right.
I didn't even know that was like, I didn't even see the scalpel. Like they don't, it's like, you don't even know. So,
right.
So I think those are two, like, the 3 Ps is one, and then kind of these like, questions ahead of time. And then for postpartum, really kind of like the big problem. I mean, there's a lot of problems, but I would, in my opinion, one of the biggest problems is this time from, day 1 to 6 weeks postpartum. This black hole of postpartum, like
It's a good way to
hell.
describe it.
Yeah, it's just this like chasm, right? It's like we go from, 100% attention on us to 0 attention on us while we're physically recovering from either a major abdominal surgery or a vaginal delivery. We have hormones are dropping. We haven't slept. We're trying to keep the screaming baby alive. This might be our first time doing it. Maybe we have a toddler at home.
Say, if you have another little, yeah, that was so hard. Yeah.
Yeah. And it's like, and you're like, oh my God, how am I going to poop? Like my butthole is ripped open. It's like this huge, and then they tell you, like, don't do anything. You shouldn't be lifting 10 pounds, or you shouldn't be this and shouldn't be doing that. And you're like, okay, well, I have a toddler, and
my toddler's like, carry me.
Right.
Those were the 2 words that were screamed at me for.
Yeah. Yeah. All the time. Wait, up, mama, up, mama.
Yeah. Right. Like, yeah. Just rest.
Yeah, just right. Sleep when the baby sleeps. So there's like this whole kind of acute recovery portion that's missing in birth that is present with every other procedure. So for example, like if there's, let's say you have, I don't know, whatever, like a gallbladder surgery or a, knee surgery. Like you get kind of, this is how you need to be moving in the bed. And this is, like what you need to do for pain. And this is who you call if you notice your incision is, blah, blah, blah. But there's nothing like that for postpartum, especially C-section. And for our C-section moms, like we need to teach them in these early stages, like how to get out of bed, how to lift the baby, how to cough, because your stomach was just cut open. So, so I think, big tip for early postpartum is to think about kind of these like early things and either get with somebody like me who does virtual sessions, or like has an online program. So you can have kind of this like early recovery, as far as pain management, as far as swelling, as far as tissue healing, early mobility, like a safe walking program before the 6-week mark. Because what happens is that there's nothing at all. And then at 6 weeks, it's like, okay, you're good. You can do whatever you want. But there's been this whole period of like atrophy, basically. And then so how are you going to, like, if you were a runner or whatever, how are you going to just like start running at 6 weeks postpartum when like you didn't run at all? And then you were pregnant for 9 months. So like that doesn't make sense. So this whole kind of idea of like early recovery and like some core and pelvic floor stuff from the beginning before jumping back into CrossFit or spin or bar or whatever it is that you want to do.
Love that.
So there's kind of like a lot rolled into one, but I think really thinking about postpartum in these kind of like phases, as opposed to time, right? Like, it's not that you're supposed to be, XYZ at 6 weeks. It's like this whole phase might last, 8 months or 12 months. And then however long it lasts for you is fine. And then we move to phase 2, right? Once so instead of putting like a time limit on, this kind of like, oh, you should be doing XYZ at 6 weeks. It's like, well, let's look at it kind of more as like a phase and function.
Yes. Yeah. And totally case by case.
Yeah. 100%. 100%. Yeah.
Amazing. There's so much good stuff here. And I've said this a million times, but just so important. And I just don't get it why we don't learn more about this. You are
Yeah.
amazing for
Oh,
doing
thank you.
this and
Yeah.
just taking this on and being that person. I know, so many women are curious about how to prevent complications. And you're right, that preventative, taking that preventative approach is key. And
Yeah.
I love that you're focused on that. So
Yeah. Yeah.
please tell listeners how they can find you. Tell us
Mhm.
about, you have a free webinar. Uh,
Yeah. 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 Yeah.
Tell us all the things, how people can work with you and, what they can do to prep for this super wild time in life.
Yes. It is like the wild, wild west,
It
isn't it?
is.
Um,
I can personally vouch.
yes, same. Same. So I would say, if you just Google me, Marcy Crouch or the Down There Doc,
Okay.
my website will come up. I'm thedowntheredoc.com. I'm
Such
on
a great name.
Thank you.
I love it.
I'm on Instagram, TikTok, Lemon 8 apparently is like a new app. I don't know.
Oh my God, I feel old. What is it?
I don't even
In
know.
line?
It's called Lemon and then 8.
Oh,
I have
wow.
no idea. My intern, who was in college was like, "Oh, there's a new app," and I was like, "Okay, whatever."
Oh.
So we're on there apparently.
Okay, cool. I'll
Yeah,
check
no idea. Most of the time I spend out on Instagram. So like,
it. Yeah,
yeah,
right.
Instagram.
Yeah.
And then we have a podcast also called No Mama Left Behind.
Hmm.
That will be coming out later this year as well. My podcast partner is on maternity leave with her second. So,
Yes, yeah.
yep. So we'll be recording, probably a couple months from now. And then our webinar. So on our website, thedowntheredoc.com, we have a whole bunch of freebies. We have like some PDF downloads, we have some free videos.
Awesome.
And then we do a webinar pretty frequently, called Push Prep 101. And
Awesome.
it's about an hour. And I teach you the 3 Ps. And then we do
Awesome.
like a Q&A and we connect with other moms. And it's really great because there's women kind of from all over the world that come in.
Mm,
Um,
so
and
cool.
then I have our paid online programs, and we have 3 right now. One is called Elevate Your Birth. So it's
Mm,
kind of like the webinar, but on steroids, basically.
okay.
And then we have the early days, which is a manual that we put together for that like early recovery phase.
Oh,
And then we have our
in every doctor's
postpartum.
office.
Yes, I know. And then we have our postpartum pelvic floor kind of longer term recovery program. So
Amazing.
that was what we have now. We're restructuring a little bit and kind of combining some things and updating
Okay,
some videos and that sort of thing. So hopefully that the new stuff will be out by the end of the year.
perfect.
But if people want to get into the programs now, you have lifetime access. So when the new stuff comes out, you'll just get shifted over to that group.
Awesome.
And as you just said, it goes by 9 months goes by so fast,
Oh, yeah.
so
Hmm.
it's never too early. It's never too late. We want to just make sure you have what you need.
That's so true. I know. I feel like it goes by so fast for everyone except the pregnant woman, but it
I
really
know. I
does
know.
go by so fast. Oh,
I
thank you
know.
so much, Marcy. And I
You're
will put all of
welcome.
this good stuff in the show notes so everyone can check you out because I know you can help so many listeners. So thank you.
Thank you so much for having me. I love chatting with you and I hope this was helpful for all you ladies out there.
I know it will be.